Hi everyone. This is our project presentation for CS613. We are five people per usual. It's me, David, Robert, Christopher, and Tommy. So our project is dependent on idea of healthcare. I have worked before in a healthcare and a similar kind of data sets in professional setting. We all were really interested in a healthcare idea, so we decided to move forward with it. This is a pretty much overview of what we'll be covering in this presentation. First is problem statement. Second is data source, where we are pulling the data from, what are the resources. Third would be related work regarding this project. And fourth would be methods or model that we plan to implement as a final deliverable for this project. Um, so let's dive in and talk about a problem. Me and David both will talk about the problems one by one. So as I said, it's related to healthcare. We are picking up Alzheimer's disease. It's one of the leading disease right now in the US. It's the disease itself, nothing but loss of a memory. It could happen at any stage of your life, but it is tend to happen when you get a as you eventually get older. And this disease could eventually lead to dementia, which means you tend to forget everything pretty much that has happened in your life or the people around your life. And there has been a lot of drug development regarding this disease, but there has not enough research has been done, or a solid solution or a medicine that is developed to cure this disease so far. Also, this disease can be navigated early in your life.
Alzheimer's disease is the sixth leading cause of death in the United States and is estimated to affect nearly 6 million Americans currently, and that estimate is expected to increase to over 13 million by the year 2060. Annually, Alzheimer's disease is estimated to cost the healthcare system over $300 billion, and that was in the year 2022, which is expected to increase to over $1 trillion by 2050. So treatment guidelines for Alzheimer's disease suggest that early detection is key to accessing healthcare resources and improving quality of life for individuals with Alzheimer's. However, most primary care providers are not trained or comfortable in diagnosing Alzheimer's disease and Alzheimer's disease related dementias. Just in brief, dementia is a neurodegenerative disorder which is characterized by a progressive decline in cerebellar function, or cerebral function rather, which includes like decreases in orientation and executive function. Alzheimer's disease is the leading cause of dementia, and then of Alzheimer's disease, there are two types, two primary types. One is early onset, which is only approximately 10% of the cases. Those are also known as familial Alzheimer's disease. And the majority of cases, 90%, are known as late onset Alzheimer's disease. So while early onset has some genetic the causes of late onset Alzheimer's dementia is unknown because there's no clear understanding of the disease process itself. The problem with diagnosis is that Alzheimer's disease is a very long preclinical course, which is typically characterized by mild cognitive impairments, which are often overlooked, and that can exist for decades before actual clinical dementia is is evident. Unfortunately, there's no curative treatments available for Alzheimer's, but there are some medication classes which may slow the disease progression, particularly if they are started early in the disease process. So, of those with mild cognitive impairment and early dementia, um, it's possible that they have some evidence on MRI, some imaging evidence of Alzheimer's dementia before, long before any clinical signs of dementia are presented. And so MRI interpretation early in the disease is a key focus of recent research for early identification of Alzheimer's and to support early access to drug therapies and resources for the patient and family. A literature review in 2024 found that 20 machine learning studies between 2016 and 2024 which were related to mild cognitive impairment to Alzheimer's disease conversions. And of those, the vast majority of the machine learning algorithms utilize support vector machines. But there was a paucity in data regarding the use of simpler algorithms or simpler models using just logistic regression and linear discriminant analysis, for instance. So our question is, can a machine learning model analyzing T1 weighted MRI data using logistic regression and linear discriminant analysis effectively predict the presence and severity of late onset Alzheimer's disease?
Our data was sourced from Kaggle, though it originally comes from Washington University in St. Louis's open access series of imaging studies, MRI dataset. The dataset consists of 80,000 brain MRI images from 461 patients diagnosed at different stages of Alzheimer's disease. Since MRIs are in three dimensions, the images were then sliced along the z axis in order to create 2D images. A subsection of those were then chosen for the study. These 80,000 images are further categorized into four classes based on the patient's diagnosis. Around 67,000 images of non dementia patients, 13,700 where patients exhibited very mild dementia, about 5,000 images from patients who had mild dementia, and lastly, just about 500 images of patients with moderate dementia. Right away, we recognize an issue. The dataset is highly imbalanced with far fewer images of moderate dementia cases. This imbalance could lead to bias where the model may struggle to correctly identify later stages of the disease, especially as we transition from a binary classifier in which our model would try to predict whether the patient does or does not have dementia to a more robust model which attempts to classify severity as well. In our next slide, we will discuss data pre-processing, including how we plan to address this imbalance to ensure fair and accurate model training.
So to make sure we have fair model training, we will have both binary and multi-class classification. For the binary classification, we will take approximately 480 images from the non-dementia class, have them as non-Alzheimer's. For the other three classes, we'll randomly select 162 images from each of them and label them as Alzheimer's. So we have a balance of 50%. And for the multi-class classification, since the moderate dementia class has 488, we will match that by taking 488 from the other classes, so which keeps the class prior to 25%.
Now I'll be going over related work in machine learning for Alzheimer's detection. Fulton et al. Explored the application of machine learning in detecting dementia and analyzing Alzheimer's disease. Their study focused on two key approaches. First, they used ResNet-50, a deep learning model, to classify different stages of dementia with high accuracy. ResNet-50 is a convolutional neural network that is effective at recognizing patterns in medical images, making it useful for dementia detection. Second, they applied gradient boosting to mini mental state exam data, which allowed them to detect Alzheimer's disease with 91% accuracy. MMSE is a widely used cognitive test, and gradient boosting helped identify key features that differentiate between Alzheimer's and non-Alzheimer's cases. Another study conducted by Zhang et al. Took a multimodal deep learning approach to diagnosing Alzheimer's. Instead of relying on a single type of data, they combined MRI, PET, and cerebrospinal fluid biomarkers, integrating medical imaging and biochemical markers to improve diagnostic accuracy. Their model also used CNNs and RNNs to extract and analyze features. CNNs were used to process and extract visual features from MRI and PET images, while RNNs were employed to capture patterns over time in patient data. This allowed for a more dynamic understanding of disease progression.
I would like to talk about the methods that we will follow in this with this data set. We are trying to move around the logistic regression and LDA. Logistic regression would be pretty similar and clear that it's a binary classification, whether the disease has or not, whether it's Alzheimer or not. There are three edge points which we are trying to cover in one versus one logistic regression. This is an approximate approach for now. Once we move forward with our data set and play around a little bit, we'll come up with a better approach for this for sure. Normal would be, it refers to the original unprocessed data that we have regarding the data sources, and data pre-processing will talk as we go further in the presentation. Blur refers to pre-processing techniques, could be Gaussian blur, and it applies to the input of the data, which is whether it may smooth or reduce noise in the features. Kenny edge refers to the edge detection technique, which is used in image processing. You're aware that MRI scans, where image processing has been done a lot. And this is to basically highlight the boundaries of the structure, and we'll be using to identify the regions related to the disease in the brain. Next up would be one-on-one LDA, which is again approximate approach. But in this we have again similar three: normal, blur, and canny edge. Logistic regression LDA would be two different classification techniques, distinguish between whether it is a disease, Alzheimer's or not Alzheimer's. Then normal, blur, canny edge again refers to pre-processing techniques applied to input data that we're gonna have. This improves the model performance, especially when dealing with the image data like a brain scan. This setup suggests that will suggest that we are specifically working on the image data sets. The whole data sets that we are going to pull is most of it in an image source, whether some of them are divided into different categories, and then we will pull them and pre-process them and then work on these methods accordingly. So that was more about the methods. Thank you.